Hello, good morning. I'm Cristina Saura. I'm medical oncologist, leading the breast cancer unit at Valdebrón University Hospital and also the breast cancer group at BHIO in Barcelona, Spain. In breast cancer, one of the main reasons that help us to increase the survivorship of our patients is the early detection. This is very important because we know that as soon as we detect the disease, we have more chances to cure patients. So this is one of our goals. We invest a lot in new treatments, in precision medicine. We invest a lot of efforts there, but we have to change a little bit our minds and also invest in prevention and early detection. And it's for that reason that we decided to also implement a new project in early detection in breast cancer. And the idea of this project came from a patient that we received in the hospital, and she was worried about the possibility of transmitting breast cancer with the breastfeeding to the second child. She was breastfeeding the second child when she got pregnant of the third child and diagnosed of a breast cancer during that pregnancy. So we received Maite in that situation, and she bring us a breast milk sample to study if it could be possible to transmit the breast cancer to the second child. We explained very well that this is not the case. It's known that the cancer could not be transmitted through the breast milk, but that was the sample that started the project that we are now building. So the first thing that we did, it was analyze that sample that it was provided to us, and we were able to identify ctDNA in the breast milk sample that the patient provided to us with the same mutations that were present in the tumor of the patient. So that first analysis was very encouraging for us, but it's more or less what we could expect as we consider the breast milk as a source of liquid biopsy. So the next step, it was to confirm that, and we collected samples from other patients diagnosed of breast cancer during pregnancy or breastfeeding, and we collected different samples of breast milk and blood of these patients. In that situation, we were able to publish last year the first results, and it was more or less always the same thing. We were able to find the same mutations that are present in the tumor of the patients in the breast milk, and the samples of blood analyzed at the same time were negative because the shedding of the ctDNA in blood, it was not enough to be detected in blood, but yes, in the milk. So this is the first step of the project, and now we are moving forward with this information to use that as a potential tool for early detection of breast cancer. We discussed a lot these results with Ana Vivancos, the head of the genomics lab, and then we decided to build an agnostic platform, an NGS agnostic platform to be used in the breast milk, and it's what we call a young women breast cancer biopanel that includes the mutations that are more common in young women diagnosed of breast cancer, and this is the tool that we aim to use as a potential tool for early detection of breast cancer after pregnancy, using breast milk as the source of liquid biopsy. So we are still working on that, working hard. The project started due to fundraising initiatives that we have here in Spain, and it was very beautiful to see that this project started with a fundraising initiative that it's called El Paseico de la Mama, that it's a fundraising initiative that started coming from a family of a patient that was treated also of a breast cancer during pregnancy. So we started receiving this money, and with this money we performed the first analysis, and then with the first analysis performed we were able to apply to different grants, public grants, competitive grants, and we were able to be funded by the Fero Foundation with funding of the Ministry of Health here in Spain, Instituto de Salud Carlos III, with Spanish Agency Against Cancer. So it was very important for us, that initial funding, to see if our hypothesis was really good. Then we continued with public funding, and now we are applying to big grants, European and international grants, to fund a prospective clinical trial to validate prospectively the tool that we created for a potential early diagnosis in the postpartum. So now we are working a lot on one side, continue analyzing samples provided from healthy patients. We decided to move forward with the validation of this test as a potential tool for early breast cancer diagnosis, testing patients with at least 38 years at pregnancy, or collecting samples from healthy germline mutation carriers, because we think that these are women at high risk of having breast cancer. So we decided to start the project in these women. So we are starting to analyze retrospectively samples that we have on site collected in that situation. On the other side, we are applying to international and European calls to fund the prospective trial that have to include, or we calculated that we have to include about 5,000 women in that situation to see if the tool is really useful to be used in the clinical practice. We are building at this moment bridges between and alliances with different institutions. We had very good relations with France, Italy, UK. We are also building strategies with the US, just to see also when we are able to have this funding, also to test women from other countries and test how we can analyze those samples and process them and everything. So here, the last thing that we have to take into account is also the regulation of this test, because we are thinking about the potential use in clinical practice, and we are also dealing with the issue of the IVDR of the test, and we also have a grant to help us on that process. We are working hard from the very beginning in the genomics lab to develop the test following the guidelines for this application, this European application of the IVDR. Okay, so as an oncologist, thinking about projects in early detection, it's not very common, but because we are used to think in projects comparing drug A versus drug B. But as I mentioned in the very beginning, I think that we have to start investing our efforts also in prevention and early detection. So this is something again that moves us outside our comfort area, but I think that it's really worth to invest our efforts there. So these women, after the breast cancer, after the delivery or after pregnancy, don't have a very specific screenings, because the mammographies in most of the countries start at 50 years. In some countries we are considering to decrease that age to 45 or 40, but there is no specific tools for screening after pregnancy. And in European countries, the women are deciding to delay the age of pregnancy. And this is something that starts to be a problem, because pregnancy at a young age is a protective factor for breast cancer, but being a mother at an older age could be a risk factor for having breast cancer, or at least a peak after the pregnancy. So I really think that it's worth to invest efforts on that, and for that reason we decided to move in a project that is really interesting and useful for the community. As another tip or something that you have to do with your project, it's to be passionate. So I think that this project, in all the team that we are working on, makes us to be passionate on that, because we really think that we can change something that can improve breast cancer in a very specific population, young women, all of them mothers. So we really think that we could make a difference there. And things that are really limiting moving forward with the project, it's definitely the funding. It's not easy to fund a big project. We are now trying to achieve more than 10 million euros to fund this prospective trial. It's not easy, but we are working hard. We have a very good team, but the funding, it's really a limitation for that. And regarding all the technical issues and the regulatory pathways, I think that it's not easy, but we are building the team very compromised from the very beginning to take the best decisions and moving forward in small steps, trying to consider all the factors. And one of the strategic decisions that we took in that general development of the test is that we want to maintain at least all the development part in the academy, so we are working with no companies involved on that, so we have all the control of the test in the academy. We are working with the genomics lab, also with the bioinformatics team, with the quality team, innovation team, but everything it's at least in the very beginning or in the development initial part within the academy, and we are discussing a lot between us, but until we feel that we are ready for the delivery of the test, we will work internally and with all the partners involved in the project to have the best test.